Hello everyone, myself Dr. Ritu Chauhan. Today I will be discussing about urinary tract infection. These days, especially in winters, people suffer from such kind of infections. And in day-to-day life, we deal with such patients, but patients sometimes don't know what is the disease and why this is happening in their body. So, I will be telling general things that a person should know about this infection of urinary tract. So, what exactly it is? Urinary tract infection, it is also called bladder infection. An infection in any part of urinary system, the kidneys, bladder or urethra. Very common things about UTI is it is treatable by medical profession. Usually it is self-diagnosed. You can easily diagnose it. Lab tests or imaging often required. It is short-term. It resolves within days to weeks. Urinary tract infections are more common in women. They usually occur in the bladder or urethra, but more serious infections involve the kidney. The bladder infection may cause pelvic pain, increased urge to urinate, pain with urination, and there is blood in urine. A kidney infection may cause back pain, that is lumbago, nausea, vomiting, fever, and chilling of the body is associated with fever. Symptoms, these are usually self-diagnosable. People may experience in urinary tract infection pain, and the pain areas are in the bladder, groin, lower abdomen or pelvis. Circumstances when pain is experienced in the patients can occur during urination or during sexual intercourse. And the condition of urine is sometimes it is foul smelling, frequent urination, bladder spasm, cloudy urine, dark urine, persistent urge to urinate, sense of incomplete bladder emptying, or there is blood in urine. There might be whole body fatigue, fever, or malaise. And very common also cramping or vaginal irritation. It is also experienced in some patient. Now, how can we prevent urinary tract infection, reinfection? With the following tips, you can prevent UTIs. Number 1, empty your bladder frequently as soon as you feel the need to go. Don't rush and be sure you have emptied your bladder completely. Wipe from front to back. Drink lots of water. Stay away from feminine hygiene sprays, scented douches, and scented baths products. They what do exactly is they cause the irritation only. 5th is cleanse your genital area before performing sexual activity. 6th is urinate after sex to flush away any bacteria that may have entered your urethra. The 7th one, if you use a unlubricated condom or a spermicidal jelly for birth control, consider switching to another methods because these things they can cause irritations, all can make UTI symptoms more likely. Number 8, keep your genital area dry by wearing cotton underwear and loose fitting clothes. Avoid tight jeans and nylon underwear, they can trap moisture, creating the perfect environment for bacterial growth. We very well know that any infection, they have risk factors. So risk factors for UTI are age. The rate of UTI in women gradually increases with age. Number second is incomplete bladder emptying, which allows the residual urine to be rapidly infected by bacteria present. And causes includes are pregnancy. About 50% of pregnant women will experience UTI. Number second, bladder, uterine or any other pelvic organ prolapse. If there is a prolapse of any organ, then it is the cause for repeatedly getting infection in the bladder. Number third is sexual intercourse, which seems to trigger a UTI infection in many women, although the reason for this is unclear. Fourth one, use of condoms with spermicidal form as a contraceptives. Fifth, immunosuppression with certain medication or drugs if patient is taking. And sixth is in diabetic patient. Seventh, menopause with the attendant loss of estrogen. Abnormalities of urinary tract such as kidney or renal stones, which act as a focus for infection. If there is a stone, there are possibility of UTIs. Ninth one is instrumentation of urinary tract. For example, there is a catheter in urinary tract. Catheterization, cystoscopy, if it is there, then they increases the chances of UTI. So this is the general information about UTI. So keep it in mind, and if somebody is experiencing such symptoms, please visit your nearby doctor so that you get it cured at early stage. Thank you, doctor.